Now, we shall try to focus on a very important anomaly of the fetal heart, the atrioventricular septal defect. Picture 1 is a scan of a normal heart. Concentrate on the normal offset appearance of the valves. All the valves in video 1 are functioning normally. I always insist and advise my fellow doctors to carefully observe the offset appearance of the valves. In picture 2, the valves are clearly in a straight line, which cannot be missed. But if you observe very carefully in picture 3 and 4, you will notice that the loss of the offset appearance is subtle but present. You will have to examine this patient very carefully and thoroughly for any and all signs of AVSD in different views. I had performed the scan on this patient at 19 weeks and 3 days gestation. Unfortunately, the baby had neonatal death on day 4. Video 2 is also a scan of the same patient. Atrioventricular septal defects can be balanced and unbalanced. In picture 5, the same patient's aortic valve was narrow and measured only 1.6 mm, whereas normally at 19 weeks gestation, the aortic valve should be measured about 3 mm. Now, how can you confirm that there is aortic stenosis? It is by looking at the 3-vessel and 3-vessel trachea view. In picture 6, you can see that the pulmonary artery is 4.9 mm compared to picture 5, in which the aorta in the 3-vessel trachea view is very narrow. Picture 7 showcases an image that looks like the offset appearance is lost. However, this is not a case of AVSD. It is a dilated coronary sinus secondary to persistent left superior vena cava. Video 3 is also of the same case. A persistent left superior vena cava can be found as an isolated finding, or it can also be a part of a cardiac anomaly. We will discuss this case further in the next video. If you want to study further, read up on the topics atrioventricular septal defects and types of ventricular septal defect.